നമസ്കാരം, റേഡിയോ സുനോ 91.7 FM-ൽ നിന്ന് ഞാൻ RJ അഷ്ടമിയാണ്. ഇന്ന് എൻ്റെ കൂടെ I have a very special person. He is a person with full of knowledge and experience. ഏകദേശം 20-ലധികം years of experience in cardiology department, and he is a primarily interventional cardiologist. പക്ഷേ ആക്ച്വലി ഒരു കാർഡിയോ ഓങ്കോളജിസ്റ്റ് ആവാനും അല്ലെങ്കിൽ അതിനെക്കുറിച്ചിട്ടുള്ള കാര്യങ്ങൾ അറിയാനും ഈവൻ ഒരു ക്യാൻസർ തെറാപ്പിയും കാര്യങ്ങളിലൂടെ തന്നെ എന്തൊക്കെയാണ് ഒരു കാർഡിയാക് ഇഷ്യൂസും കാര്യങ്ങളും വരുന്നത്, ഇതിനെക്കുറിച്ചിട്ടൊക്കെ ആൾക്കാർക്ക് അവയർനെസ് കൊടുക്കാനുമൊക്കെ ഒരുപാട് ഇൻട്രസ്റ്റ് ഉള്ള ഒരു ഡോക്ടറാണ് എൻ്റെ കൂടെ ജോയിൻ ചെയ്തിരിക്കുന്നത്. സോ വെൽക്കം ഡോക്ടർ Rakesh Gopal is joining with me right now. Sir, it's my immense pleasure to have you here on Radio Suno 91.7 FM. We already talked a lot.
Thank you for calling.
Yes. So ഞങ്ങളിങ്ങനെ സംസാരിച്ചുകൊണ്ടിരിക്കുകയായിരുന്നു. So let them also know about how the oncologist and cardiologist comes together. അത് രണ്ടിനെയും ഒരു മിക്സ് ആണ്. ഇറ്റ്സ് യു. ഒരു ക്യാൻസർ പേഷ്യൻറ്റിന് ഒരു ഹാർട്ട് ഇഷ്യൂയോ കാര്യങ്ങളോ ഒക്കെ വരുന്നത് എങ്ങനെയാണ് ഡോക്ടർ, അല്ലെങ്കിൽ വാട്ട് ഓൾ തിങ്സ് ആർ റിലേറ്റഡ് വിത്ത് ദിസ് ക്യാൻസർ തെറാപ്പി?
First let me say what is oncology. Oncology means cancer. And it's related to therapy and its implications. For a quite long time, people didn't know that the cancer patients are prone to get cardiac events. That's one. Second thing is cancer therapy itself can lead to a lot of cardiac issues, which needs attention. And we never realized that most of the patients who survive cancer, their actual, if somebody survives cancer for 5 years, the commonest cause of death in them is never cancer. That may be a real news to you.
Yeah, it's a misconception which people have.
Majority of the patients who survive cancer for 5 years do not die of cancer. They die of something else, and that something else is usually a cardiac issue. Another thing is many of the drugs used in oncology, in cancer drugs has peculiar cardiac side effects. Some of them can affect the cardiac pumping. Some of them can cause heartbeat irregularities, something like fast heart rate. Some of them can actually cause slow heart rate. Some of them can cause a syndrome, something similar to a heart attack. Though it is a little different from the heart attacks you usually see. And many of them can cause heart muscle inflammation. Some of them can cause heart pumping impairment. And such complications are known. More than anything else, the risk factors for cancer and the risk factors for cardiovascular disease are convergent. Most of them are similar. Some of these patients can go on develop cancer. Some of them can develop cardiac issues. But most of them remains without both. So we are yet to understand more details of that, but there's some interplay.
You said അത് എങ്ങനെയാണെന്ന് മനസ്സിലാവില്ല. So when a person, like if a person is having, a patient is having already a cancer, how he will know that he is developing the cardiac issue? Like
that is what exactly cardio-oncology is all about. It's about we know certain drugs used in cancer, like adriamycin. It's a very commonly used drug in cancer. Typically used in breast cancer and other cancers also. It can cause cardiac pumping impairment due to heart muscle damage. A newer generation drug called trastuzumab. It's a directed therapy against certain receptors, so-called targeted therapy. They also have cardiac side effects, including cardiac pumping impairment. But these two things do affect in a two different manner. So knowledge about them, that these drugs can affect the heart. If you know them, you can upfront prime the patient. See, these drugs can cure cancer, but it can affect heart. So you can prime them. These potential side effects can occur. So you watch out for certain things, and you report in case of symptoms like you develop breathing difficulty, chest discomfort, effort intolerance, and report. So on a periodic basis, there are some guidelines. We do the echoes, we do echocardiographies, we do frequent clinical examinations and look for these side effects and make the patient aware of this, and also the oncologist and also the patient's relatives. to me, the awareness should come from those who care for cancer. They need education first, because in general, people think cancer is the end of everything.
That's right, yeah.
Suppose somebody develops cancer, you say, okay, everything ends here. Because, and the people prefer to call this as malignancy. Okay, that's the end of the days. And suppose somebody develops a cardiac problem over that, then these patients are being told to, sorry to say, including the doctors who treat them, tends to say, this gentleman has got cancer and now he has developed a cardiac problem. So this will be the end of cancer, because the cardiac issue is going to kill the patient. So if you have solutions for a problem, it's going to be through science. Why India should go to the moon is not to go to the moon, but to prove that the Indian science has remedies to cure our problems, cure our disease, cure our poverty, cure our issues. So science is the answer. To prove this, we have to go to moon.
When he's saying this, I should say he's having a lot of knowledge about spacecraft and all those things. He's so interested in all the space-related things, right?
Rather, I should say
he's not only a doctor.
I'm interested in science, and I believe in science.
Yeah. Okay.
If you ask me my motto about cancer, the therapy and its implication on the heart, it's like we say, fight cancer with all your heart.
I just heard it just before this interview from his mouth.
Cancer is not the end of the days.
True.
Okay, and having developed cancer, see, if you have a heart attack, basically I'm an interventional cardiologist. I do coronary interventions, I do peripheral interventions, I do percutaneous valve replacements, I do carotid stenting. That's my primary job. But I have interest in this because I know I can make a difference to people's lives.
Yes, when you say like you have to understand the patient and also the relatives, and you want to make sure like they are alive, you travel also to a lot of countries, and as you said, your motto to treat them with all the heart. So is that the reason why you are going to, I think he almost went to all the African countries, even Asian countries, and everywhere you have been there. So can you just tell me about your travel experiences?
See, I hardly travel on leisure. At most of the places I've been, it's like I just land there on work and then finish work and get back. I've not been, but I've seen people. See, I'm very fond of working for people who are in need. There are a lot of areas in our own country, especially the northeast, East India, and countries nearby, including Bangladesh, Nepal. Then you have the entire African continent, where the basic infrastructure doesn't exist. Countries including Somalia. I've been even to Somalia.
Okay.
So creating infrastructure in this place of need is something very interesting to me. I have first-hand experience of seeing life there. How people live there, what people eat there, I know. So you know how long the apples are cultivated? It grows only 3 to 4 months of a year. So why apple is in the stores throughout the year?
Yeah.
Because we learned how to store apple. It's as simple as that. So what I'm saying is science and technology will take you places.
True. Okay, എന്തായാലും ഈ പറഞ്ഞ പോലെ എൻ്റെ കൂടെ ജോയിൻ ചെയ്തത് ഒരു മലയാളി തന്നെയാണ്. ഈവൻ ദോ ഹി വാസ് ടോക്കിംഗ് അബൌട്ട് എവറിത്തിങ് ഇൻ ഇംഗ്ലീഷ്. സാറിൻ്റെ അടുത്ത് നിന്ന് സത്യം പറഞ്ഞാൽ ഇനി ഒരുപാട് കാര്യങ്ങൾ അറിയാനുണ്ട്, ചോദിച്ചറിയാനുണ്ട്. നോളജ് ടു സീക്ക് നോളജ് ഫ്രം യു ഇസ് റിയലി ഗുഡ്. സോ താങ്ക് യു സോ മച്ച് സർ. ഇറ്റ് വാസ് എ വെരി പ്ലഷർ. Thank you so much, sir.